projects. And another great opportunity provided by SICAN that I want to say is that they also bring together another partners that otherwise wouldn't not have seen the opportunities of the city. And I can name two beautiful projects that we've done with them. One was with IBM, who come to Asunción, and we developed this beautiful model for standardized pathology reports, and now we are working also with direct relief for a readiness for access for drugs for breast cancer. We developed with CITICAN's model the first two protocol guides for breast and cervical cancer, and the Ministry of Health has approved by resolution to be used in the national level. And I think those kind of things are very important to demonstrate to other partners that the results achieved impact the community, and they are very measurable, so we can still achieve another goals with this kind of actions.
2017-2018, when Access Accelerated through the World Bank gave funding to catalyze change in the systems in terms of NCD care, and we were chosen as academic model providing access to healthcare, which is a collaboration and another collective action that has been very successful between Moi University, Moi Teaching and Referral Hospital, and several US-based universities led by Indiana University. And so we were chosen to implement this on behalf of the Ministry of Health and together with the Ministry of Health. And I think I had never learned the lessons that I have learned in these 3 years, even though I thought I knew everything there was to know. Because for the first time, I was in the deep end, learning what he has been saying today, and I'm thinking, why did somebody tell me this 3 years ago? I mean, I thought we were just going to go about it the same way we had always done, where we set out to screen patients and give numbers, and the funder would be very happy, and the ministry would be happy, and then we'd close the books and look for more funding and do it again. But this time, we developed the entire protocol collectively, with the funder putting input, with the World Bank putting in input, and with ourselves, the implementer, also putting in input. But also the communities had their voice, and they said, this is really what we don't have. This is really what we want. And this is what we would want to see as outcomes. And so together we were able to come up with really an excellent program that was speaking to the needs of a community. But at the same time, we were able to, for the first time, input the evaluation process of this program from the beginning, before we started. And we had the ministry on the table, we had the county governments on the table doing this. The results of that have been amazing, and it's really been a school for me, because not only did we have performance outcomes, not as good as when we did individual action, I must point out, because we were not able to drop blood pressure by 15 millimeters of mercury in terms of mean blood pressure change. Indeed, the outcomes show that the mean blood pressures of the clinics did not really drop much. And when you look at it, you realize it would not have, because you kept screening and bringing in new patients. Yeah? But we have now adapted, the communities have adapted the system of getting screened. It is an ongoing practice now in these communities. The county governments, for the first time, are actually looking at data when they're planning their next year's plan, something they've never done. They used to just, guesswork. For the first time, they actually introduced a budget line for diabetes and hypertension and cancer screening, something that they had never done. But more mind-blowing is that at the national level, because we did this in partnership with all these players, for the first time the national strategy has introduced a big line item that says integrating non-communicable disease control at the primary level. That was against policy before this. And they have also gone ahead to get funding to actually scale up several elements of this model to the entire country. So in 2 years, we've achieved what we never achieved in 8 years because of the collective action.
In Africa, we are still not able to join our force to act collectively in prevention and control of NCDs. We are back to back. By acting collectively to prevent and control NCDs, maybe in Cape Verde we have the experience that the expenditure will reduce drastically. The cost of the cost of doing collective action will be more cheaper than if we work back to back.